Welcome back to Overnight America. Randy Tobler in for Ryan Recker, and we're joined now by Paul Seegert, who's played an integral role in changing the way businesses manage their second largest expense. What is that? Well, it may be getting people connected remotely right now, but in general, it's human resources. And he's going to help us unravel some of the spokes that come from the COVID-19 hub, which has been a real nightmare for employers. I can tell you, as the CEO of a little hospital in Northeast Missouri, it's a nightmare. How you doing, Paul? Thanks for joining us.
I'm doing fantastic. Thanks for having me.
Hey, so I guess good news for business people, good news for employees, not only those who have jobs and will get a check, but those who don't have jobs and will get a check. But for those who do have jobs, they'll be able to, some who may have been on the rocks because of the business that they are working for being threatened with existentially with, prolonged shutdowns and on and on. The president, I guess, bluffed. I mean, I guess he blinked and he signed the bill this evening, I guess, with reservations. What's in it for the payroll protection program, and what does that mean for employees out there who are listening?
Well, it's a big deal. We've got $300 billion that is going into what we call, I guess, it's being called PPP2. And not only is there a significant cash infusion into the program, there's some really key changes for business owners. One of those is the fact that they can now get tax deductibility of expenses that they paid for using PPP funds. That wasn't true prior. And so that's a big deal for business owners. And some nonprofits will be eligible for the first time. And that's going to bring in a lot of new PPP loans. And they've got $20 billion that they're adding into the EIDL grants. And they've got some specific funds set aside for different categories, $15 billion for live venues that have, of course, been hit really hard, and $12 billion that's set aside for those in low income or minority communities. So it's, from a business standpoint, it's very good news. Now, there are, of course, businesses that haven't made it. I mean, it's a pretty sad story for lots of businesses in 2020. 110,000 restaurants alone are closed permanently, about 1 in 6. So it's
I know we talked with Chef Andrew Gruhl, who's with the Slapfish, organization, and founder of that, actually, last Monday. He's been quite active in advocating for, and really, I think, calling out the hypocrisy when you can go into crowded stores, big box stores, and it seems as though there's just been a, government picking winners and losers. And unfortunately, the losers are those who have put their life savings, second and third mortgage their house. I don't think you can get a third mortgage, but you know what I mean.
Absolutely.
And losing their business. But it's good to hear, now, you talked about deductibility of stuff that the business has purchased with the loan that could be forgivable. Is that going to apply to the first tranche of PPP, of some of the money that they borrowed or not?
I think some of this is yet to be clarified, but that is my understanding, that became a huge issue. And so they made that move to correct that here in the second round. And there'll also be an opportunity for some businesses that have been hit incredibly hard but have hung on to get a second PPP loan. So that some of these funds will go to first PPP loans for those that hadn't applied yet. But in some cases, and if they can show a downturn of 25% or more of their revenue in one quarter of 2020 over the same quarter in 2019, then they can apply again. And
you mentioned some money to support
be the lifeline some need.
You mentioned some support for live venues. Do you mean entertainment facilities? Theaters, movie houses, or does that include nothing in there for restaurants as a carve out? Huh?
That is a crazy thing. I mean, there's a lot of push for a restaurant act that would target that industry specifically because it's obviously in a free fall. You've got, I think it's more than a third of those that have hung on to this point, some 500,000 that remain or so. A third of them say if things continue as they are, they will not be open in 4 to 6 months. I mean, that's incredible when you think about it.
Yeah, and not only that, in trying to stay afloat, many of them have spent buku bucks, both with indoor partitions and other accommodations, and of course sometimes some fairly elaborate outdoor facilities to accommodate that. And, we've seen it here in our metro St. Louis area where there's been lockdowns and there's been some civil disobedience. It hasn't really, they've threatened to enforce it. Whether or not that's going to go through or not, I don't know in individual cases. But, between trying to defend potentially against the government, prosecuting you and the expenses you incurred, and a lot of these are small, mom and pop outfits, and maybe they flow through with an S corp or to a personal tax return. You could see people just filing bankruptcy on top of the business failing. I mean, this could be just the ripple effects could be devastating.
No, there's no question. I mean, 44% of our economy is made up by businesses that are under 500 employees. It's about half the jobs out there. It's just, pandemics aren't a new thing, but the way we've handled this pandemic is new. We haven't ever told businesses that they have to simply shut their doors, turn off their revenue, and somehow try to stay afloat. This has been a crazy year.
Unless you happen to have a very big business that sells the very same items in aisle 23 and 24 that the small business retailer doesn't sell. I mean, or sells. You know what I mean? So that to me is
totally agree.
That's the major head scratcher, isn't it?
It is. I won't mention any names, but I go to a national retailer just about every weekend. I've got 5 kids, and somebody has to teach them how to work. So I'm doing some remodeling on my own home, and it's maybe 50% of the folks in there are even wearing a mask, and there's no issue made of it. And yet these restaurants are just, and other small businesses like them are under great pressure and fear and stress about how they can do it with reduced revenues and increased expenses that you pointed out to accommodate all these new requirements. And then the starting and the stopping, and they think they've got it on track, and then maybe another lockdown hits. I'm in California, and I'm watching them go through that again, where they're just shutting their doors. It's heartbreaking.
Well, what are some of the ways that employers who do have some revenue, it hasn't been a total collapse, total lockdown, maybe they're considered, those essential businesses, but still revenue's down because people either don't have the money to spend or they're limiting their shopping exposure. What are some of the ways that employers and employees can work together with some low-hanging fruit? Maybe it's not a big expense for the employer. Maybe there's what kind of things can employers do to try to retain employees and show good faith, and at the same time ask reasonable but not crushing sacrifices of employees so that together they can move forward after this thing's over?
Yeah, some of them have found, some of the businesses that we've had the opportunity to work with, and we have clients all over the country, they've found places to recover some of this lost revenue. The overhead costs of running a significant office, some of those things are going away, some of those costs, and many of them won't come back. They're finding out that they can be just as productive remotely. I think that's part of the solution that some businesses are finding that we're talking to, and then looking in their cost stack on a P&L and saying, what are some of our largest expenses? Healthcare is an area that I talk about every day, and the average business now is spending more than $15,000 per employee per year on healthcare. When you factor in the dependent costs and everything else, it's a massive expense. And it runs about, in our experience, there's often an opportunity to shave as much as half of that expense without reducing the quality. And there's that can be a huge opportunity for employers.
Well, I'm curious, how are you doing that? Because one of the things we've been trying to advocate, and it's actually been hard because of, I think, the lock that brokers have from the traditionally fully insured products is a direct to provider, make that hospital system, doctor's offices, whatever, a direct relationship.
That's part of the solution.
Yeah.
Absolutely, and it can work out.
We've even promoted a retainer-based solution. And that's one step beyond that. I mean, sort of, a throwback to HMOs, but take out the middleman, except for the most, consequential illnesses, very high-end tertiary care, and you just have a wraparound policy for that. It's a fantastic model, but it's hard to break through the brokerage, the broker industrial complex, right?
Oh, believe me, that's my. I have that conversation every day, 5+ times a day, and that is the conversation I'm having on a daily basis. There's so many people involved in this massive sector of our economy, or a sixth of our economy is tied up in healthcare, and really, it's more so tied up in how we pay for healthcare, how we fund it.
That's
which
right.
is what you pointed out.
We're spending a lot of time talking about insurance and not buying health care. Hey, we got to head to a break. Can you hang with us after the break? Because I'd like to talk with you about vaccines and especially mandates in the workplace for various essential industries and whether or not that's going to gain traction in the employer groups. It's interesting, and some of the legalistics behind that. Paul Seegert is with us. He's the managing partner at PCS Advisers. Well, we're back on Overnight America on KMOX. Randy Tobler in for Ryan Recker. And we're talking with Paul Seegert, who's the managing partner at PCS Advisers at PCSadvisors.com about, everything COVID as it's related to employment and employers and employees. And, Paul, I think this vaccine issue is going to be an interesting one to watch because the EEOC issued some guidelines a week or so ago saying that it's okay for employers to mandate vaccines. Now, there's certain conditions that have to be met, but I'm just curious in what your advice is to your employers. Let's say they're in a service industry, healthcare being number one, of course, maybe food service, some things where it's essential not only to avoid litigation, just because ethically and morally the right thing to do to protect your clients from infection, but also we have a responsibility as employers to keep our workplace safe for other employees. So what are you advising? Obviously, it's going to be beneficial for the workforce at a given place to be vaccinated. But what's the best way to do that? Is the carrot or the stick the best way?
Well, we're seeing it being done in different ways. You pointed out a few of the industries where we'll most likely see mandates, healthcare, travel, retail, and where it does make a lot of sense. But one part of the story that's not being told, some of the feedback that we're getting is that although employers may really need to mandate the vaccine, that employees be vaccinated, not only to protect the other employees, and to protect customers and do what they feel is morally the right thing, but for liability reasons. They have an obligation really under OSHA to have a safe workplace. And so there's potential liability for them if they don't. There's liability if they do, potentially, and if they don't. But the CDC and the EEOC both agree COVID-19 meets the direct threat definition where they can mandate this. But another part of the story, another interesting thing that we've seen is that some employers are, even though they feel they should and that it would be the right thing to do, they're fearful that if they do, they'll lose the employees they need to run their business. We've gotten that feedback from some of the folks that we work with who run nursing care facilities. They have a tough time filling the jobs as they are, and they've got folks that have left just out of the sheer concern that they would be forced to receive a vaccine that they're nervous about.
Wow. Yeah, at our hospital, surprisingly, I mean, I would think that healthcare workers and people in the medical industry would be just absolutely couldn't roll their sleeves up fast enough. But with that, I mean, there's suspicion out there because it's new and it was quick. And of course, what they don't know is that the development was very quick as opposed to other vaccines. But the quality and safety analysis and testing was no different than a vaccine that takes 4 or 5 or 6 years to develop, like on the traditional platforms. But anyway, the news is out there that this may be so novel that it's got all kinds of unappreciated risks. We've only have about 65% of the folks in our building, and that's a high number among my colleagues in the industry, of people that want it. And we're currently, our leadership team is concocting a way for those who don't want to get it to maybe, everyone would be eligible. We're thinking of just having like a lottery. If you get your vaccine, we're going to give away some iPads or something. I don't know. We're going to try the carrot approach because the stick, I think, is fraught with potential pushback and potentially, what if someone gets an allergic reaction? What if someone gets some other untoward reaction? even if it's transient. I mean, you can see all kinds of just a legal quagmire coming out of sort of the forced mandate approach. But you can do it with some restrictions, right? There's some exceptions. Employees can't say no.
That's right. You also have to deal with reasonable accommodation by the ADA. So if people have certain disabilities, they could be excluded or be in that accepted group. And then also, if you have sincere religious objection, then you could also have an exception. Of course, an employee could say they have a religious objection, and it's really tough for an employer to question that, even if they think that may not be sincere. They have no way to. They open up more liability by digging into that.
That's a question I had. I mean, can the employer say, give me a note from your pastor or your imam or your rabbi or?
They can, but if you go to the HR
intrusive
attorneys, they're going to tell you don't do that. You can, but you're certainly asking for trouble, right?
Well, I've even read in some of the guidance, some of the interpretive follow-up to the guidance, that since there's a pre-vaccination questionnaire, that's standard for influenza, any vaccine, and we routinely give ours at the workplace, that it asks, do you have an allergy? Have you ever had the vaccine? Of course, in this case, everyone's answering no. But I've read variable things, so I'm hoping you can clear it up for me. One source seemed to imply that if they just refuse to answer the questionnaire, they're out. I mean, that's an easy out. And you mentioned another one just to say, well, I've got a religious objection. I'm done. But is asking them to answer the questionnaire, if it's mandated, could that be a loophole that employees could use if they wanted and say, well, I refuse to do that because that's an intrusion into my medical privacy?
My expectation is that will work, and employers will err on the side of caution. Yeah. When dealing with getting into these HR issues. That seems to be the trend.
So are you just advising education and, here's another question I had for you. Okay, so let's say we're going to go easy on it and we're going to tread very lightly and err on the side of trying not to do the mandate. Can you do something like this? Okay, you're part of my employer-based health plan, dear employee, and for those employees who choose not to get vaccinated, should they come down with COVID-19, the health plan won't cover it for that specific problem. Could you amend your plan to do that? Because to me, that would be like the ultimate American way, right? You have a choice, but there's going to be consequences if you choose to do something, and I'm not going to own the consequences of your choice, dear employee. Does that work or not?
Well, there is some precedent for that kind of thing. We have whole state health plans that have different premium amounts that they charge the employees if they're a smoker, as an example, versus being a non-smoker. So it's not without precedent that you could tie consequences to decisions that employees make. So I would leave it to that's the kind of question we would take to our ERISA attorneys and have them give us guidance on. But we certainly have seen there is precedent for being able to tie consequences to decisions.
Well, there you go. Well, so it'll be fun to hear what folks say as those different formulas of trying to get folks into the program with vaccination, how that's going to all work out. That dance between employer and employee will be interesting. The last thing I want to touch base with you about is the pharmacy story and how we're going. That is driving most of the increase in premiums and cost sharing with employees from year to year. Again, it's happening this year again. What's your take on that? What can employers do and what can employees do to try to help reduce the cost for everyone?
Well, at the employee level, be a good consumer. Unfortunately, the bad news is, and I have strong confidence in the American consumer, and I think that empowering the American consumer to be able to consume like they do in all other areas of their life will be a huge part of this fix for the way that we pay for healthcare. But we've trained the consumer. We've tricked the consumer in a way. We've hidden real cost behind copays and deductibles. And we've trained employers to buy healthcare 1 year at a time and prepay for healthcare. And then forget about it for a year, and the costs have been going up incredibly. And then at the employee level, we've trained the employee or we've insulated the employee from the real cost by having them look at a $20 copay when the drug that they're being prescribed might cost $2,000 or $5,000 or $10,000. So there's this system that we have currently, and I'm speaking about the insurance end of it largely, is not providing the information that the consumer needs to consume effectively. Yeah. And unfortunately, it's by design. And right now we analyze plans all the time. In my first career, I was a Russian intelligence analyst, so I am officially a nerd. And I look at data, and we see about 30% of a typical health plan is on drugs. Shoot, if you go back 10, 15, 20 years, that gets down into the single digits. You're absolutely right. The increased drug costs is the biggest challenge we face, and it's on track to be as much as 50% of a plan. We expect to see an employer's health plan, 50% of that cost overall will be drugs in the next 2-3 years, very likely. Yeah. And
those are good watchwords. I mean, ultimately, the employees are going to pay for it through lower wage increases, higher cost share, and I think you're right. I mean, we're going to have to get a handle on that. I know Amazon's got some online pharmacy things coming out. There's other innovative ways, but I think personal responsibility. Again, we just talked about it in the other realm, and I think here it's important too. Folks have to try to do some health and wellness practices too to reduce the burden, because it affects everyone. Hey, Paul, we got to jump off. I really do appreciate you being with us, and I would hope folks would check with you if they have questions in these matters. PCSadvisors.com.